Great. Okay, so this week's video is brought to you by Osteopathy Unlimited. All right. Thought I'd put together a little bit. I've just been talking to you about a patient. These are conversations I have with patients all the time. So hopefully by putting them out there, it's of value to you as well. So this one is the truth about pain, or at least the truth as far as science can understand it. There is a lot of misconceptions about pain. So I'm going to just lay out what the current medical model is. What we know about pain is it's actually a product of your brain being sent into your body, which is quite different from what most people's construct of pain is. Usually we associate doing something like we're hammering something and we hit our thumb with a hammer and we squash the thumb and that pain goes up to our brain and then we feel pain in that point, go, ah! And that's actually not how it works. The reason that I used to think that is because we always associate pain with the trauma. Because when we hit our thumb with a hammer, we remember it, right? But what we don't remember are all the times that we hit our thumb with a hammer or we stub our toe on the bed and it doesn't hurt. We don't remember those times because there's nothing to remember. We stub our toe or we hit our thumb and go, oh, that didn't hurt. And we just carry on, so there's nothing to remember. So we never remember the fact that we have trauma without pain. We always remember the trauma associated with pain, so we think that the pain is in the body sending up to the brain, when in reality pain is in the brain coming down into the body. And there's two main types of pain that people feel. The first type of pain is a very sudden, very rapacious onset of very, very, very sharp pain, often associated with a muscle spasm, okay? And this kind of pain is a warning from your brain to you, telling you that the thing that you're doing is about to cause a serious injury and it's got to stop you by getting that spasm in and stopping you from physically doing the thing that's going to cause an injury. So whilst that's not a particularly nice thing to feel, it's a very, very important thing to acknowledge, because if you're going to ignore that pain signal and just do the thing anyway, or if you're going to take painkillers and try and cancel that signal out in order to do the thing that you want to do, you're going to be causing a much more serious injury, okay? So that sharp, stabby kind of sudden pain is a warning saying, stop what you're doing, don't do it that way. There might be another way for you to do it, but you can't do it that way. The other kind of pain that people often talk about and present with is a less severe type of pain. They describe it as more of an achy kind of pain, or a toothache sensation, which is less severe, right? And it's still painful, so it's not nice, but it's less severe, and it's generally felt first thing in the morning when you're getting out of bed, or if you've been sat down for a while and then you stand up to go and move. And what you're describing there, what you're hearing, is a beautiful description of inflammation. This is when tissue has already been damaged and your nervous system knows what's going on. Your brain and nervous system is way smarter than you, and mine's way smarter than me. It registers that there's damage. It picks up on the fact that there's histamine now circulating in your bloodstream, and there's a whole complex chain of reactions taking place to provide you with the soup to pump into the tissues to fix it. Yeah, you need inflammation to heal tissue, and although that sucks, there's no way around it. Now, if the tissue's got a good blood supply, it'll happen really, really quickly. If that tissue's a lot harder, like a ligament or a tendon, it's going to take a little bit longer. And you'll know when it's fixed because you wake up in the morning, get out of bed, and then there's no problem, all right? So you've got the sharp, stabby pain, which is a warning from your brain to try and stop you doing something, usually the way that you like to do it. And then you've got the sort of achy, stiff pain first thing in the morning or when you're getting up out of a chair, which is the pain of inflammation. Now, when you get moving, that achy inflammation pain, a lot of that fluid will flush out of your tissue, and so the pain will disappear, and you think, ah, great, I'm better. It doesn't mean you're better. The next time you stay still for long enough, fluid swells up and you've got pain again. And they're the two main causes of pain, although there are other kinds of pain. You may well be suffering with exhaustion or tiredness or stress. If you're constantly exposed to tiredness and stress, your nervous system is capable of misfiring, and then you can get symptoms coming into your body of pain, which are of it's not a warning. It's not that you're doing anything wrong, and it's not because you've injured something. It's just because your system has been overloaded and it's misfiring. And that's usually quite easy to detect because people are usually exhausted. So there's another cause of pain that could be going on. You could be suffering the side effects of medication that you're taking. Okay, so if that's the case, again, there won't really be any characteristic to this pain. It will be fairly consistent, and it won't be responding to any kind of treatment that you're getting. In which case, if the pain is really debilitating, then you're going to need to look at coming off the medication. But there will be other things you'll need to do. It's not very wise to just come off medication. You're going to want to look at trying to support your body's systems and try and get things to function better so that you don't need the medication. So if you're coming off heart medication, for example, because you're getting pain in your body, it's a good idea to make sure that your connections between your brain and your heart are working really well, or maybe looking at dietary factors that could be causing your blood pressure to go up. Drinking more water, really simple stuff like that. So that's another important one to remember, is the side effects of medication. So yeah, that's a bit about pain. But my favourite one, and this has happened maybe 3 or 4 times in my career, is I've had people, it was usually the older farmers, people who used to work on farms when they had threshing machines and they've had limbs cut off, and they got pain in a leg that they don't have the leg anymore, right? But they're telling you, they say, I've got a pain right in my foot, or if we use the hand, it's like, oh, I've got pain, you know, right here in my hand, where my hand would be, but the arm has been removed. And so you have to explain to these people that that pain in your leg or that pain in your hand can't be in your leg or your hand, because your leg or your hand isn't there. It's been cut off. They're saying, yeah, but I'm going to point to it. It's right here in my arm or my hand. They say, yeah, if we were to follow the nerve that would have gone to your hand and trace that nerve all the way back into your brain, what you'll find is there'll be an excitation of your brain at that point, stimulating that nerve going into the arm or the hand. And so in that sense, you can't treat an arm for pain if the arm isn't there, if it's been cut off. What you're going to look at is looking at ways in which you can relax that brain activity, and that comes down to oxygenation in a big part, because a lot of the pain spasm cycle that you'll get will be maintained by not breathing out enough. So if you can control the breath to making sure that you exhale fully, you can get a lot of that pain spasm cycle down. So that's a little bit about pain and the causes of it. Probably the worst thing that you can do if you've got pain is take an anti-inflammatory, and I'll tell you why. Because if you're taking an anti-inflammatory, the inflammation that your body's producing to pump in and heal the tissue, if you take the anti-inflammatory, you will, if you're lucky, get rid of your symptoms, because you're going to stop the inflammation from building up and being pumped in. But in addition, you are going to stop the inflammatory processes from occurring that you need to heal your tissue. So you kind of cut out the pain, but the tissue doesn't heal. And if you haven't got pain and you're now working a tissue that's still injured, you're going to have a much bigger disaster further down the line. So there you go. There's a bit about pain. Hope that helps. Hope that makes sense. If you're interested in learning more about ways that you can deal with pain naturally, just send us an email to info@osteopathyunlimited.com. Hope you're having a nice time. Have a lovely weekend. I'll be back at next week at some point. I can't say when, but there'll be another video with some nice juicy nuggets of information. Thank you for listening. I'll see you in another video. Okay.